Welcome back. More information is coming out now showing a clear connection between heart disease and COVID-19. We turn to the experts at Intermountain Healthcare to learn more about the research and the long-term implications.
One of the most harrowing effects of COVID-19 is severe damage to the lungs. Now there's more evidence indicating the heart is taking a beating as well from COVID-19. We have Dr. Kirk Knowlton, Director of Cardiovascular Research at the Intermountain Healthcare Heart Institute, joining us now. And the connection that we're seeing is very concerning when it comes to some patients who suffer from COVID-19. What is that, Doctor?
Yeah, it's a very interesting story that's evolving, and we're learning more about it as time goes on, almost every day. But this is an area that I've had interest in for much of my career, in understanding how viruses can affect the heart. And we know that most viruses can affect the heart in some people. And we're just now, in the very beginning of the COVID pandemic in Wuhan, China, they noticed that about 20%, or 1 in 5 of the people who were admitted to the hospital had evidence of heart damage, where their heart was not functioning as well as it normally should, and there were muscle proteins being released into the blood like people sometimes have with heart attacks. And they also found that those people who had evidence of heart damage were much more likely to need intubation, advanced breathing support, and many more of those died. So now we're further down the line, and we're learning more about what might even happen to people after they have recovered from COVID-19, and that there could be some challenges or problems that exist in their hearts as well.
That is the fear of this long-term damage. And what I'm learning too is when it comes to viruses, maybe the body is responding where you're attacking your own body, and that's when the heart gets damaged. Is that how it's working?
Right. Well, that's a great question, Saray, because I think we're still learning about exactly how it happens, and it probably happens differently for different people. One of those is just as you said, the virus, there's a global activation of the immune system. They call it a cytokine storm, where there's so much activation of the immune system that it affects other organs that could affect the heart also. But we're now learning that the virus can actually infect the heart itself, which could activate an immune system. And then another really important aspect is that we've seen that the coronavirus can activate clotting or thrombosis that has caused pulmonary embolus, strokes, and it now appears that it may be causing thrombus in some of the heart blood vessels, making it so that they don't function properly either, as one of the mechanisms by which it can occur.
And the concerning thing is some of these issues may not be reversible.
Well, and the good news first, I think, is that most of the time, when people get infected with a virus, or at least a good percentage of the time, there is some improvement. But now we're finding people are doing studies on individuals a couple of weeks after they've have recovered from coronavirus, and they no longer have evidence of the virus in their system. They are doing specialized studies to look at their heart, and they're finding that indeed there is some evidence of damage in a subset or a percentage of those patients. We don't know exactly how many. In very sensitive tests, it may be higher than we think. It may not always be in people who have been in the hospital and people who have maybe less severe illness, that there can be problems.
Dr. Knowlton, so much good information and so knowledgeable. The key is let's keep our community safe, continue to do the things that we're supposed to do, mask up, exactly, and keep our community safe and get the flu vaccine, all of those other things, and mask and social distancing. For more information, go to intermountainhealthcare.org. Thank you so much, Dr. Knowlton.
Thank you, Saray. Thanks for having me on.